So just a little bit about us. So we are Menopause in the Workplace. Our aim is to ensure that everybody can continue to thrive at work. So they still have that opportunity to get the support and the resources that they need in order to continue to do the job that they love. So the session today, as Laura said, is I'm going to do some got some slides for you to talk through, but then at the end there is an opportunity for you to ask some questions. If you want to put them in chat or hold on to them and we can do them at the end of the session, then that would be great. But just to let you know that we are a organisation that is here to describe, not prescribe. We don't offer medical advice, but we do signpost to places where you can get this information, and we give you resources and support in order to be able to support your colleagues through their menopause journey. So let's start with a little bit of just the agenda. It's not a big arduous presentation, honestly, but it's just to be able to let you know what we're going to cover. So first of all, we're going to talk about how becoming a menopause friendly employer can actually save you money. As organisations, we're always trying to be as efficient as possible and as productive as possible. So this is how this can actually save you some money there. And also, most importantly, some practical tips. So how can you actually implement this support? What can you do? Some free of charge resources as well, and how you can start this journey really. So let's start off with, if you want to at any point during the session, if there's anything that you want resources, then please do put it in the chat. But we have created a menopause friendly business case. So if you are looking to secure some budget around menopause friendly awareness, menopause friendly membership, there is a business case that I'm happy to share with you. You can get that through directly through me. My email will come up at the end of the session, but also you can access this through Laura. If you need to, email her and she'll come back to me. So there's some statistics that I'm going to share within the presentation that are contained in this business case. So if you need it, please do shout. So how can being menopause friendly actually save you money? Well, you're just going to look at some stats, as I said. So there are 33 million people employed in the UK, and 5.87 million of these are experiencing menopause symptoms. So that equates to 18% of the workforce is menopausal. Can't even say the word. And it is growing. The menopausal individuals are the fastest growing demographic in the workplace. So this is continuing to increase. So this is why we are looking at this, and we'll continue to look at this area. As an organisation, we've been in place for 7 years, and we're continuing the work that we started to ensure that everybody within these 18% are supported. So how does menopause actually affect your productivity within the workplace? And we are aware that obviously menopause symptoms don't just happen in the workplace. They do happen outside of the home, but outside of the workplace in the home. But this is just really thinking about how your menopause symptoms will affect your productivity within your workplace. So 75% of people, research said 75% of people report experiencing with poor concentration, which then can affect their ability to continue in their role. And also 70% of people report experiencing stress related to their menopause symptoms and how that impacts on their ability to continue to do their job. And then 67% of people report experience a loss of confidence, and loss of confidence, brain fog, are just two of the symptoms, psychological symptoms that are experienced with menopause. And you're probably aware of the physical symptoms that people will experience, so your hot flushes, your night sweats, etc. But the loss of confidence and the brain fog are symptoms that aren't always immediately recognised. And the 67% there is, I'm just going to share a story with you that my colleague who was working with a large food manufacturing organization, international food manufacturing organization, and she did a presentation recently. I was talking to one of the senior managers who was talking about in the last couple of years how they haven't gone for promotions. People in their team haven't gone for promotions. And when she's spoken to them about, why have you not gone for that job? That would be ideal for you. You have all the experience, you have all the knowledge. And they have reported back that it's down to a lack of confidence, not in their ability to do the job, but their concern around the interview process and how they may be sitting in front of a group of people being asked questions and that they wouldn't be able to recall this important information that would be vital to the interview process. So based on this feedback that they've given, this particular organisation now have included in the content that they have in their around recruitment, that during the interview process notes can be taken and notes can be brought into the interview, so that it gives that individual that confidence to know that whatever situation they're in, they can refer back to that note. So if they have a brain fog incident, or they're struggling to recall that vital piece of information back in their memory, that they've got a bit of a safety net. So it does impact on individuals' ability to progress sometimes into different roles. But how can this being menopause friendly actually save you money? So again, research is showing that 35% of individuals have taken absence for menopause symptoms, but actually only 9% disclose the real absence to their managers. Some organisations now are recording reasons for absence and the menopause symptoms. Some don't, but a lot of organisations now are identifying this so that they can, again, work to support and provide the resources that are required. And it's still shocking, and I see this statistic so many times, but 1 in 4 people consider leaving work due to their menopause symptoms, and in fact 1 in 10 do, which is a significant amount of people who this is impacting on their workplace and their ability to thrive within that organisation. And we know that these statistics probably are just the tip of the iceberg. We know that people may not be completely honest about the reasons why they're leaving work, and so that 1 in 10 may also be might actually be quite a low number in reality. But there's a cost associated with this. There is an impact on that organisation, and how does that person leaving, taking all their knowledge, taking all their experience with them. But the financial impact around that is that the average cost of recruiting an employee is around £6,000. So as an organisation, retaining staff, retaining the knowledge, retaining the experience will also improve that or continue that productivity, but also from a financial point of view will keep the costs down. Also, when it comes to attracting talent, we know more and more organizations now are looking more and more individuals are looking for organizations that do demonstrate support around menopause. At the bottom it says 147% increase in job posts that mentioning menopause, and 52% of workers say a wellbeing program in the workplace is a must-have. But this demonstrates that there is a need there, that there is a requirement. There are people starting to ask these questions. How are you going to support me? What's the organisation going to do? So from a retention of staff point of view, but also a recruitment of staff point of view, being menopause aware, menopause friendly can be really beneficial. So how do we turn this into some practical tips? So we're talking about how can you do this? So is it clear within your policies, on your website, if you're looking at recruiting in new talent into the organisation, is it clear how your organisation supports menopause at work? So is there some kind of guidance? But do your managers know how to use this guidance? Have they got the confidence? Have they got the knowledge to be able to use this guidance document, use this policy? Doesn't have to be a policy. Not all organisations work with policies. A lot of organisations I work with have toolkits or a guidance document. How often is this being reviewed? Is this incorporated into other policies within your organisation? Have you got that knowledge within your managers? Do you need to do some training for them? Do they need to gain some knowledge and education around this subject? Nobody's expecting the managers to be medical experts. In fact, far from it. It's about having a good, supportive conversation. It's about ensuring that that knowledge is there. And where does this need to sit? Is it with HR? Is this occupational health? Is this something external that you're signposting to? But it is ensuring that that information is there. And again, if you want any further information around this, please do come back to me, either directly to me or through Laura. When it comes to workplace facilities, and obviously every organisation is different, and it may be if you're in manufacturing, your requirements obligations are going to be different to an organisation where everybody is sitting at a desk. And we work with organisations to look at this and how they can provide some reasonable workplace adjustment. The examples on the screen are things like temperature, ability to change temperature, having a desk fan, but also having a space where individuals can go to get some quiet time, to be able to use some washing facilities if necessary. But though also from alongside those practical support, the things like, if you're having a lot of online meetings, would it be okay if somebody's not feeling their best to be off camera for a while? Is it, as I said before, when we were talking about going for interviews, if you go into meetings, it's acceptable to take notes, to be able to send emails to follow-up meetings, to again be able to support that individual so that they don't struggle with being able to recall this information. And there are all, it says there are on the slide about individuals that stand for a long period of time. I'm working currently a lot with schools, and we're working with how they can support the teachers and the teaching staff to be able to ensure that they can factor in some breaks around the lessons to be able to support menopause symptoms that they're experiencing. So there's lots of practical tips that we can offer and come back to with you if you need anything. And yeah, an example of a workplace adjustment risk assessment that can be put into place. So it's poor concentration or lack of confidence. This may be affecting an individual's ability to progress with a project because they're finding it difficult to make decisions. So considering what you can put in place to support them. Is it that they may work off site better? It might be that they work better in the afternoon, maybe shifting their working hours, changing the workload, changing the project deadlines. Is there anything that you can support them with in order to be able to ensure that this particular symptom doesn't affect their ability to complete this task? So how do we start talking about it? I'm giving some examples of practical tips, but how do you start this conversation? And we always say, how do you start talking about it? Start talking about it. It may be difficult, so maybe put some posters up, some examples of posters that there for you. One, the one on the left, the Henpicked one, giving some statistics around menopause, and the one on the right is around menopause symptoms. The one on the right is available in many different languages, so you can also display that to be able to reach out to communities and cultures that maybe wouldn't necessarily be wanting to speak to you directly. So you can use a poster to be able to engage and encourage that conversation. Think about things like workplace champions that maybe that you've already got in existence, and well-being champions. Can you incorporate some knowledge and education around menopause into their role? And then there's also some free resources that you have access to. So we've got a menopause hub that is access to our menopause, our henpicked.net website, and there's loads of free lunch and learns on there. There's some existing videos on there, lots of content that you can download and signpost your colleagues and team members to. And in line with that, it's World Menopause Month. This month, October, is the month of World Menopause, but World Menopause Day lands on Friday, on the 18th. And the theme this year, slightly contentious one, is HRT. So if you are looking to discuss that within your organisation, you're looking to signpost around this, then go to our henpicked.net website. There are a multitude of videos on there. I think we've got about 5 pages of them now. There's over a couple of hundred. But specifically around this topic, I've put some examples on the screen of specifically related to HRT. So there's also ones there around alternatives. HRT isn't always the right route for everybody, and there may be the individuals that are looking for further information for alternative and complementary. So there's one there about menopause and herbs, there's one around alternatives to HRT, and then obviously there's ones there around questions about HRT. So go onto the henpicked.net website, click on the Menopause Hub, look for the tab that says videos, and you'll find all of these. They're all free. You can download them, upload them to your intranet, etc. And also, following on from the menopause, we at the beginning of the year launched training around menstruation. So I just wanted to give you a tiny little snapshot as to why this happened. It was following on from a lot of conversations we were having with organisations around menopause that leads into women's health. So we've now got menstruation awareness training for colleagues, line managers. We do menstruation awareness champions training, but I just wanted to leave you with some statistics around why this conversation is continuing. 70% of individuals struggle to carry out work in the way they'd like to during their period. That's a significant proportion of the individuals that are affected by their symptoms. 25% have had to take time off, and they feel this has affected their career progression. But 87% have had to lie to their manager about the reason for their sick days. So going back to identifying reasons for absence, whether it's related to menopause, maybe a question to be asking around menstruation as well. If you want any more information about that, I've just put a tiny snippet of information in this presentation. But if you are looking to raise awareness around menstruation, you're looking for any further information, do come back to me. And there's my contact details, julie@henpicked.net. Please email me. You're very welcome to go through Laura, and she will be able to send you my way as well. But just to remind you, if you're looking for the business case, please let me know. More than happy to send that over to you. And our Menopause Friendly checklist, which is a brilliant place to start to assess where you are at the moment and what you can be doing to continue in the great work I'm sure you're all doing. And that is me. Did I make it? Did I do it in my allocated time? I did. Amazing. I'm handing you back to you, Laura. If you have any questions, please shout.
Thank you very much. As always, really informative. A quick tour of us, I suppose, menopause in the workplace. And we've got no questions coming through in the chat at the moment, but I just wondered, Julie, if you could tell us a little more about reasonable adjustments in the workplace and any other experience you've had, or any other really innovative things that people have come up with to support menopause in the workplace.
Yeah, absolutely. So there is one in particular, I'm not sure if you're familiar with it. It's called the Black Cardigan Initiative. It started a couple of years ago by an individual she works for a very large housing association, and it came from the need to have a way of covering yourself if there's been a bleed. So we will often grab something, wrap it around our waist to be able to get ourselves to the toilet without people seeing that we've had a bleed, or that there's our flooding has come through our clothes. And so there is now an initiative called the Black Cardigan Initiative, where you go to some organisations and there are long black cardigans hanging in toilets, hanging on the back of chairs, that individuals can grab, wrap around their waist, and be able to walk to the toilet or changing room or bathroom to be able to change into other clothes, but without being concerned that people might know what's happened. So that's one. And also more around things like using some technology, following up meetings with emails. If there's conversations that have happened that have had in a corridor, we do it all the time. We stop, we chat in a corridor, following up these conversations with an email, following up these conversations with notes that individuals can, rather than trying to record this information. Another example around manufacturing, one of the organisations I work with, large food manufacturing, all of their manufacturing uniforms, their boiler suits are all white. This is a concern for individuals that may be experiencing, again, flooding, bleeding around menopause, and they've all moved them all over now to navy. So again, there's the not the stigma attached with the concern around having a white uniform that would be more obvious if there's been a bleed.
So thank you, Julie. Really appreciate that. As always, fantastic presentation.